Hey guys, thanks for tuning in here. I do apologize for our makeshift setup here. This was really the best way that we could kind of figure out how to get sound on this and still be able to do a video presentation. So, without further ado, Emily and I had reproductive and sexual health as our Healthy People 2020 project. So if we look at our assessment portion here, we can see that the largest impacts we found were on overall health and well-being of individuals. So there are 19 million new cases of STDs in the US each year, and half of those are attributed to 15 to 24-year-olds. So that's 8.5 million cases just on our age group. Guys, that's alarming. We really need to get better about condom usage here with sex. That's so important for preventing these STDs. And as a result of that, there are currently 1.1 million Americans that are currently living with HIV, and of that 1.1 million, 20% of them don't know that they have it. So that's really sad and that's really scary. Another side effect here, untreated STDs can lead to some serious long-term health issues, especially in women. Women are more likely to suffer from infertility and fertility issues if they don't get these STDs treated early on and they're not caught early on. And then in regards to stages of life that this affects, it can affect pretty much everybody right from the day they're born all the way up until they die. With infants, we find the biggest risk is typically for those whose mothers did not have prenatal care during their pregnancy, and those babies are 3 times more likely to have a low birth weight, and they're 5 times more likely to die from sudden infant death syndrome. And then adolescents, like we talked about just a minute or two ago, primarily due to those 8.5 million STD cases, that's where our main effector is, but adolescents are actually also significantly less likely to complete schooling if they become pregnant. So again, with the condom usage, birth control is super important as well if you're sexually active and a young female. Definitely going to keep those unintended pregnancies down to a minimum. And then for our older adults, this one's a surprise for a lot of people. They're primarily at risk for HIV. That's one of the most common sexually transmitted diseases in older adults. Excuse me, I lost my train of thought here. This is primarily due to their decreased condom usage. A lot of people think that when they get older, just because they're kind of out of that age range of having children, that they don't need to use condoms when they have sex anymore. That is not true. You're still super susceptible to STDs, especially women over 50. You're actually more susceptible to HIV just due to age-related vaginal changes that are going on. But 45% of HIV diagnosed cases are in adults over 50. So that's still really scary. And then if we go ahead and move on to our objectives here as a result of those, we're looking primarily at education, access to healthcare and its location, insurance, financial status, stigma and social norms, and sexuality. And just before we move on, if you guys want to take a peek at this map over on the right-hand side of your screen, so this shows by state areas, or rather states that are having a hard time with no insurance. I'm gonna have to cut this. So this map on the right here is really good about showing what states are currently struggling to get their populations insured and which ones are not. If we take a look kind of in this little southern portion here, Oklahoma, Texas, Arkansas, Louisiana, they all have really high uninsured rates versus, say, Vermont. If we take a look over there, it's a white state in this map, so that means that we have relatively low uninsured rates, which is so excellent. And just a couple more graphs for you guys before we move on to the diagnosis portion here. The one on the left here shows some really uplifting news. It's showing that generally women who received higher levels of education were much more likely to have access to reproductive health services in the last 12 months. So that's really excellent. That means that these resources are getting used so long as they're accessible. And that is so important, and we want to see those resources getting used and not going to waste. And then if we want to take a peek over on the right-hand side of your screen again, so this one shows the increase in HIV cases among different age groups. So you can see here As the graph moves from left to right, the older someone is, the more likely they are to contract HIV. And if you'll take a look at these percentages, this is actually for positive HIV serostatus. So that means somebody who's positive for HIV. 94% of people over the age of 55 know if they're positive or not. That's super, super positive, and this data is based off 2016, so it's probably fluctuated just a little bit, but those numbers are going to be relatively similar, and that's so good to see that people are at least aware of the fact as to whether or not they're positive or negative. So our diagnosis here. We can see with the information here, if you look in each of the four corners of your screen, that we're meeting 4 of the goals so far, and that includes education, accessibility, sexuality, and social norms. So it's becoming more and more of a normal thing for people to get tested, to have these open-ended conversations with their partners, seeking prenatal care. If you look down in the lower right-hand corner, it does say that most cultures will seek prenatal care as long as they have access to it. The one real stipulation with this is Mexican-American women and mothers. They're significantly less likely to seek prenatal care just due to cultural biases, and they're typically more likely to be uninsured. So that's really the only catch that I noticed with there, but we are having teen pregnancy rates fall, STI rates are falling, so all of that is really, really excellent stuff. And then for our scholarly articles here, the one on the left talked a lot about healthcare individuals, healthcare providers are really getting out there and just kind of working with adolescents and young adults. And they found that evidence-based counseling services, when made accessible, were taken advantage of. Use of condoms and birth control went way, way up when they were made accessible. And especially if it was done so in a non-judgmental way, like we've talked about in class before, that bodily autonomy is super, super important to these young people. They need to feel like they're the ones making the decisions about their health, and they are in charge of that decision. They're not being forced or pushed in any particular way. So that's that. They found some really, really good evidence there. So our article on the right-hand side here is in HIV among people 50 and over. This one was a little less thorough, so it was a little bit less information. You guys can, don't know that you'll be able to click on this. I'll try to pop this slideshow under this video so you guys can still click through and read stuff. So one of the main notes from this article was that healthcare professionals really, really need to ensure that they're asking patients over the age of 50 the same type of questions that they're asking their young adults and their adolescents. So are we practicing safe sex? Are we using condoms? Have we been tested in between partners? All of those questions are super, super important and typically are not asked in these older populations. And it's become such an issue that the CDC has actually gotten in on this as well. So the CDC does support Act Against AIDS, which you can read right here on your screen, raises awareness, fights stigma, and reduces HIV infection risk among at-risk populations. That's really excellent. And then from 2014 to 2019, the CDC invested over $130 million to encourage training and to promote retention and re-enrollment of HIV-positive patients to receiving care. They did notice that a lot of these patients were kind of falling off the bandwagon with their care, so they do want to make sure that these HIV-positive individuals are getting the chance to receive proper care. So our evaluation, what should we be monitoring and what does all of this mean? So awareness of your HIV status is something that's incredibly important. Sexually active women who receive proper reproductive health care are more likely to be more successful. They're more likely to have healthier children. So all of that's incredibly important. Sexual education within and outside of schools is really, really important. A lot of the reading that I did in researching this project did state that information about sex and condom usage and all of the fun stuff we've covered in this slideshow is incredibly important outside of school as well to the general public. A lot of them, did not get comprehensive education in school regarding this, so it's something that they need to be caught up on now. We've already talked about the access to proper health services and insurance coverage. That's super important. Definitely need to be reaching out to those low-income, uninsured families. That's definitely one area that we still have room to improve upon. The importance of detecting health conditions early. So that means regular STI checks. That's in between each and every partner, making sure that you're on birth control, all of that kind of fun stuff. And one positive note to kind of end this off on, teen pregnancies have dropped from 562,000 in the early 2000s to 400,000 a year. So that means we are making progress, and that's really, really exciting, guys. So there's still a lot more work to be done, but we do have some really excellent data as a result of that. Thanks for tuning in, guys.